Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of sciatica. Sciatica occurs when one of the nerve roots of the sciatic nerve is pinched. The sciatic nerve is actually a conglomeration of three nerve roots, L4, L5, and S1, that come out from the spine and then come together and form the sciatic nerve. Then they run down the back of the leg. 1 to 2% of the population suffers from sciatica at any one point. The most common reasons it occurs are due to a herniated disc, or it can occur from spinal stenosis. Less common reasons include nerve root irritation from degenerative disc disease, possibly a tumor, and possibly a problem after the nerve roots are done, such as something pinching the sciatic nerve lower down. Well, how does it occur? When a disc degenerates, the outer layer may tear and part of the inner jelly can squeeze out. So here you have a disc, and typically it has this kind of a margin. But if you get a tear in the outer portion, some of the inner jelly can squeeze out and pinch a nerve root. That sparks up inflammation and then can cause sciatica. In and of itself, that's not painful. It's the inflammation that it sparks up that leads to the pain. The symptoms of sciatica are not the same in everybody. They're going to differ from one to another. It may consist of burning, electrical type sensation, pins and needles sensation. Some people may have numbness, motor weakness, such as inability to lift up the foot, and then rarely incontinence. That's an actual surgical emergency when a person has bowel or bladder incontinence. To make the diagnosis, it's usually a combination of things, such as history and physical exam, MRI, nerve conduction may be helpful, and then possibly a diagnostic injection. Here you see a doctor performing a straight leg raise test where you lift up the leg straight, and it causes immediate intense pain, usually with a disc herniation. And then when the doctor bends the knee, usually the pain dramatically reduces because it takes tension off of the nerve roots. Here on this MRI you see a huge disc herniation coming backwards, and then the spinal cord and the nerve roots are getting pinched big time right there. Treatment of sciatica, there's quite a few options. Limited bed rest. It used to be thought that a week in bed would be the best. This has been shown to not be good at all, actually, as little as possible. Medications would include anti-inflammatories, Tylenol, muscle relaxers, neuropathic medications such as Lyrica or Neurontin can be helpful, and short-term opiates can help relieve the pain as well. Physical therapy and chiropractic treatment, TENS units, such as you see here. It's actually about the size of an iPod. It runs off of a battery. It goes electrical current through these little foam pads, and it can help change the way the brain perceives pain signals. Acupuncture has been shown to be very helpful for sciatica. Spinal decompression therapy is an FDA-cleared treatment. It's been very popular over the last 15 years. And interventional treatments such as trigger point injections, which can help with muscle spasms and aching. And then gold standard treatment is epidural steroid injections, such as you see here, where the soothing anti-inflammatory steroid is placed right around where the nerve root's getting pinched. Okay. The outcomes with sciatica treatment, over 95% of patients are successfully treated without surgery. There was a landmark study in 2006 that showed the 1-year outcome between operative and non-operative patients of sciatica were identical. Okay? Those who had surgery were able to get back to work faster and get out of pain faster, but at 1 year, no difference. Now, there are indications for sciatica surgery. An absolute indication is when you have cauda equina syndrome with bowel and bladder incontinence. That is a very large disc herniation that's pinching big time. That's an emergency. You need surgery within 24 hours to have a hope of return of bowel and bladder function. Now, when you start to have muscle weakness, which is, for instance, such as a foot drop where you have trouble lifting up the foot, you can watch that for a little while, but the question is how long. If you watch it too long, even if the surgery that's done is technically perfect, you may never get back the motor strength, okay? So that becomes a relative indication. Now, if the muscle weakness is progressively getting worse, that becomes even more of an indication because obviously something is pressing big time. Now, and then there's elective indications. If you've had 6 weeks of failed non-operative treatment or more, then the decision is an elective one as to whether or not to move forward with surgery. So it's basically what is it can you tolerate? The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rates exceed 90% at the clinics with the board-certified award-winning doctors. Visit us online today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556.